everyone. I would like to say thanks to the conference committee, Dr. Safa, Dr. Fauzi, and thank you to the chairpersons here. I would be talking about the novel technologies on the liver fat quantification and stiffness assessment. This year, I'm here to talk about the complete liver health screening. And as you will see on my presentation, the idea is, what is the idea of all this new technology? Why are we having these new technologies? So as you see, the liver problems are becoming a silent killer. There is no symptoms and suddenly it becomes too much. And most of the publications now show that what are the liver problems which are really causing issues worldwide. And whatever is the predisposing conditions, let's say related to cardiac, related to blood pressure, venous problems, the problems remains the same, meaning the healthy liver becomes fatty, then it progresses to liver fibrosis and to cirrhosis. The idea is to have early detection so that it doesn't progress to cirrhosis, and then we can help the patient on a very, very early stage. So just to classify again, as I said earlier, anything which is 5% or less fat in the liver considered as normal liver, and then the progression starts. Let's say when the fat is more than 5%, then it's a steatosis. It becomes inflammation, and then slowly it goes to early fibrosis, and then significant fibrosis, cirrhosis, and so on. So once we have the technologies available, which helps us on a very early stage to understand what's happening in the background, it gives a lot of benefit to the patient. So just to talk about the liver pathways, when the patient is having fibrosis, we have multiple imaging modalities are available, like patient can have CT scan, MRI, multimodality approach. Also on ultrasound, they can use elastography, which is acoustic radiation force impulse, to understand the liver stiffness, and also the contrast enhanced ultrasound if there is lesions available to get more information on that. Steatohepatitis, there are a lot of blood tests available, serum blood test, latest blood test also helps understand on a very early stage if patient has fibrosis. Steatosis, fat accumulation, this is where the problem comes in, and when we do a normal ultrasound, we see most of the patient have fatty liver. We don't know what's happening in the background, because sometimes the fatty liver works as a mask for the fibrosis and different other NFLT problems. We still have amazing modalities like CT, liver biopsy, and also MRI-PDFF. MRI-PDFF is a proton density fat fraction, which gives an overall idea about fat in the liver. But again, the idea is that how many patients and how many populations can expose to such big modalities like CT scan and MRI. So if we have something which is easily available for patients, which is ultrasound, and then on ultrasound you have some advanced techniques which can tell the patient easily that what's the fat percentage and what is the background, what is happening in your liver, it really helps the larger number of the population. Of course, I would say that the gold standard is liver biopsy, but we all understand the consequences with a liver biopsy. It's not really easy, and then after we complete the liver biopsies, what are the difficulties the patient can face also. And also we can't use it as a screening tool, right? So that is where the new technologies are available, and the idea of such new technologies is that to help the patient detect on a very, very early stage. As I mentioned earlier, MRI is really wonderful, and they also have a very special technique called MRI-PDFF, proton density fat fraction. This is really wonderful, but what are the pitfalls? It's really expensive. Not everyone can get access to this. It's time consuming. There is a lot of process for the patient, a lot of things required for the preparation, and it also needs sedation. So if patient have to go through screening, they will have to pay also a big amount of money if they don't have proper insurance and so on. So idea is to have ultrasound screening tool, and today I'm going to talk about two main pillars, and these two pillars will give a patient a complete liver health screening. The first one, I will talk about UDFF, which is called ultrasound right fat fraction. Patient just have to come routine ultrasound scan. There is a software available on the machine. They just apply it. It takes maybe 2 to 3 seconds, and they get the actual number of the fat in the liver. There are cutoffs available with the publication. And then the second pillar, which gives the idea of the stiffness in the liver, meaning F0 to F4, what is the condition of the liver. So that is why I call it a full health screening for the liver. And just to give you a little bit of what is UDFF, ultrasound right fat fraction, what does this do? So when the ultrasound rays passes through the liver, there is scattering and attenuation happens, and this is quantified and displayed on the ultrasound machine. It tells exactly what is the liver fat percentage in the liver. And why the scattering information is so important, because as I said that liver, if there is congestion in the heart, liver can also become stiffer. So scattering gives you a primary information that, okay, what is the real condition of the liver? Is it a primary liver condition, or it's causing secondary causes due to heart failure and so on? So this is what is about UDFF. I took maybe 2 minutes to explain, but when you actually do it on ultrasound machine, it's really simple. You just press one button and start it. It gives you a fat percentage, as you can see on the video here, and you will hear a sound. This sound, this gives a total information of fat and liver, fat percentage in the liver. And regarding the cutoff, what is the cutoff of normal liver, and then the mild, moderate and fatty. So the cutoff is 5%. Anything which is less than 5% of the fat in the liver considered as a normal liver, and then it progresses to mild, moderate and severe. Also, here just to show you, there are some guidelines which we have to follow. Patients can breathe normally. There is no good breathing practice patient have to do it, because the technologies have becoming really modern now. So just the breath hold, and you can just have to follow the guideline. As you can see this arrow here, if your cursor is perpendicular to the liver capsule, you're gonna get a wonderful results, and no need to repeat the numbers again. And on the screen, as you can see, it shows that what is the depth from the skin, and also what is the percentage here, which is 10%, which is mild fatty. And similarly, just to show you, just one click and it gives you a number. Here, the UDFF number, 13%. Whenever we talk about such new technologies, I think for all the clinician, it is important to have the clinical correlation, right? You do it faster, but it's always important for a clinical correlation publication. So particularly this particular technology on ultrasound, UDFF, there are comparisons happened with MRI PDFF. As you can see, I have 3 cases, which is the patient have done ultrasound UDFF, which is 2% of the fat percentage, and then the patient went to MRI, which is 1.5%. It's correlating very well. The second patient, as you can see, 17%, MRI PDFF 17.6%. So just imagine when you have such technologies on ultrasound, it takes your confidence to the next level, and of course patient doesn't have to go through all the modern and expensive modalities, and you can definitely help patients with the ultrasound technology. Here the third case shows 26%, and also the PDFF shows 26.5. So my idea is that when you have new technologies and they are correlating with different modalities, I think it improves and helps the confidence a lot. There are some other cases which is recently published. UDFF and PDFF had really good correlations. As you can see here, some MRI images on the screen and the 4 different images, and very, very correlating with each other. When I talk about the new technology, again, as I said, the correlations with multimodality is really important, but also the publications is one of the most important thing to accept the new technology, and we have a good number of publications done on the UDFF. This is one of the publications, but now within last few months, there are a lot of publications which you can see here on the screen with the different topics, and you can go on each topic and each publications and have more details about it. So let me go to the second pillar. We have completed the first pillar, UDFFs. The second pillar is fibrosis. You must have already done some cases with this, but with the latest generation, what you have is you don't have to take individual 10 numbers. You just can have all 10 numbers in one screen. So it is much faster, reproducible now, and very, very quick. And the best part is, if you want to have the fat percentage and the fibrosis, both the technique together, you can do it together as well. As you can see on the screen, it gives you numbers in kilopascals here, and also the UDFF on the same screen. As you can see here, you have UDFF, you also have the fibrosis. So on the same image, you can do both the technology. Within 2 to 3 seconds, you have your full understanding of what is happening in the liver. And also, there is cutoff published already from F0 to F4 for auto point shear wave, which is displayed here, which tells you that what are the cutoffs for normal liver, for significant fibrosis, severe fibrosis, and cirrhosis. These are the publications again for together for UDFF and auto point shear wave. If you have any questions, please feel free to ask. Thank you. Thank you. Thank you.
Any question?
Yes, I have a question, please. Regarding the ultrasound for fat quantification, does the body mass index of the patient affect the outcome?
Okay, doctor, this is really nice question. So we have been doing the studies. One of the studies have already been done, and no, it doesn't affect the body mass index. Even the high BMI patients we have done, because it is not taking the skin, the outside skin parameters. It goes inside the liver, and as soon as you have the liver image, nice image, you can have it. So there is no, it doesn't affect at all.
Could you use this technology in evaluating quantitatively and qualitatively the liver for donors prior to liver transplant?
Liver transplant?
LDLT, yes. Would you use this in evaluating the integrity of the liver morphologically, qualitatively, and quantitatively, degree of steatosis?
Yes.
Degree of steatosis prior with confidence without using biopsy. I mean, we rely on this technology in evaluating the degree and the percent of steatosis of the liver prior to surgery.
Yes, sir. So I have one case to share, if you allow me. There was a patient who was very young, alcoholic definitely, and was going for a liver transplant, a very young patient around 32 years old. And when they used this technology, the numbers were coming into, you know, like insignificant fibrosis, like 1.6 around, which doesn't show that it's cirrhotic, but definitely the liver was very shrunken, irregular borders, ascites, everything. The features shows it's cirrhotic. But when they repeatedly do this technique, and the numbers were quite on an early stage, then before doing a transplant, when they did it, they said, okay, let's remove the spleen because it was quite big. And then the patient still doing great. They did not do the transplant. It was non-cirrhotic pooled fibrosis or something. So it definitely helps, and they definitely rely on the numbers, especially for UDFF.
Especially for donors. Donors, not recipients. For donors.
Okay.
Liver donors.
Yes.
Evaluating their liver donors. That's
yes, liver nodules. You mean?
No, donors, the liver donors. You know, donors for the liver?
Donors, yes, yes, donors, definitely, doctor, yes.
And we could quantitate, say by percent, the degree of steatosis.
Yes.
Say 20%, 15%, 30%.
Exactly, sir.
We could do that using ultrasound.
We can do that, yes, yes, definitely, yes.
I ask about fatty liver to be transformed to cirrhosis or fibrosis. It depends on the degree of steatosis and how percentage all patients with fatty liver to be transformed to cirrhosis.
Okay, so doctor, like some of the patients who looks very, very grade 3 fatty liver, you don't see the diaphragm and so on. It looks like a grade 3 fatty liver, but when you combine UDFF, it will show you that maybe there is a significant fat around say 16%, but when you do a fibrosis assessment, it shows you a very high number. which tells you that it is not fatty, but it's going in fibrosis. So this is how it really helps, that to our eyes and to see the features of ultrasound just by looking at it, it looks like fatty, but when you have done the fibrosis assessment, you understand that, oh no, it's not just a fatty, it's going in early fibrosis. Yeah.
Thank you.
Thank you, Dr. MAYURI. The
Thank
next
you.
speaker, Dr.